Health Unit Head of Sanofi, Tisha Boatman, the Executive Vice President for External Affairs and Healthcare Access at Siemens Healthineers, Caroline Mendy, the Director of Global Policy at Roche Pharma, Ambassador Tara Sumru, UK's Ambassador to the UN Economic and Social Council, and moderator Maggie Lake, founder of Maggie Lake Media, for a conversation about unlocking accessible innovations in NCD care.
Well, hi everyone. It's wonderful to be here and see a packed room, and hello to everyone joining us online. I'm super excited to have this conversation, which we're going to talk about innovations, because I think that we all know and sense that technology has the ability to change Diana's story, right? And create an environment where she doesn't have to have that experience, and that's the end of that chapter. So thrilled to have this distinguished panel with us to talk a little bit about how we can sort of use what's happening in innovation and technology to unlock not only treatments, but access, which I think is really tied to the implementation challenge that everyone has talked about so far. So welcome, everyone. Thanks for being with us. John, I'd love you to kick off for us and talk a little bit about how the pharmaceutical industry is evolving now that we have targeted and tech prevention and treatments. What's happening from an industry level?
So it's great to be here, everybody. It's always difficult to go first, or you're not repeating everybody else, so that's quite a good start, I suppose. I think from an industry perspective, I had Sanofi's Global Health Unit, which we've been going now. This is our fourth year, and I think one of the things that we're well aware of, and the ambassador touched this at the very beginning, is that we want to do more at grassroots level, at primary healthcare level, which means the industry has to play a very significant role in training and capability building at quite often a basic level around NCDs. Because without this, we're not starting at the beginning of the problem. And I think that's something the industry has certainly come together with. We're working on several projects. I can give you an example in Tanzania where there are 5 or 6 companies have come together now, and we're really focusing on when you're going to train a community healthcare worker, you want to train them as many capabilities as possible right across the NCD spectrum. And this is very, very valuable because it allows the patient to be treated where they live, rather than having to travel long distances or not even be able to travel long distances. I think this starts before you even think about any interventions, because everybody talks about drug prices and how we need to do that. And yes, that's an area we have to work on. We have to look at affordability, and we have to look at how do we manage to make sure that as much of all of our portfolios are available as possible at cost-effective prices. But if we don't have the capabilities to prevent and manage diseases in the first place, then the interventions are lost. And actually, they can be wasted. And we've seen examples of that. So I think from a supply chain perspective as well, one of the things that we find particularly in Africa is it doesn't matter what price you start with a drug, the costs that get built on that by 10, 15, 20 middlemen in the middle is really, really difficult. And this is where we've got to look at how do we manage that supply chain piece as an industry, how can we come together and make sure that the patient gets the real value that we're looking for in the end. Well, then of course, just the final piece is, it's partnerships. It really is about partnerships. You have to have a government who's interested in building sustainable healthcare. You have to have partners on the ground who can implement the training. And then you have to make sure it's sustainable in the future when your projects are finished.
And this is, I think that last line just explained why it's a complicated supply chain and probably why we have so much friction and why implementation has been hard. But this is where technology comes in, AI. Tish, talk to me a little bit about the role that's playing. I just did an event at a procurement congress with a bunch of supply chain heads at companies, and AI is everywhere, and it's making huge changes. I've got to think there's some positive momentum there. How is that changing the diagnostics and some of the friction that John just talked about?
Yeah, I mean, thank you very much, first of all, for having me. I had, as was mentioned, Government Affairs and Healthcare Access and Siemens Healthineers. One of the biggest roles that AI can play is to take that large funnel of patients that require screening, NCDs are a very specific type of diseases where with cancer, with cardiovascular disease, you absolutely have a significant chance of both saving lives, extending life, and saving cost to a health system by early detection, right? When you look at, I'll just focus on breast cancer for a second. I mean, breast cancer, I'm a breast cancer survivor myself. The way breast cancer has really evolved in the Western countries over the last 30 years, we have extended life by 5, 10, 15 years on average. And some of that is medicines, and some of that is better treatment protocols and better follow-up. But the single biggest contributor to extending lives in breast cancer has been early detection. It's been the fact that many countries have implemented well-planned and well-resourced screening programs. Unfortunately, in low and middle income countries, this is not the case, right? Over 50% of the women in the world don't have access to breast cancer screening these days, despite the fact that it's the #1 cancer killer of women. But really, where can AI play a role? Well, a mammography screen, first of all, you don't need mammography to screen, right? I'm not going to sit here and tell you have to have mammography. I found my own cancer with a self-exam, right? So I'm a big believer in training your primary care and your community health workers to educate people to break down that stigma and to teach women to do a self-exam or to make sure those self-exams are done in annual checks. But when you go for diagnosis, you generally need mammography. And with a mammo system, that's a very difficult scan to read. So you talk about health systems that lack the right equipment, and then they lack the right people and skilled staff to read those exams correctly. AI has made huge breakthroughs in mammography. We're running programs in Vietnam, in Indonesia, really training the algorithm for the dense breasts, because let's be very clear here, AI also can have a very strong bias, right? And not all women's bodies are the same around the world. But AI in breast cancer and other types of cancer has been a huge topic in really bringing that diagnostic and also dealing with this skilled workforce topic that John brought up. I mean, you still need a radiologist. You need these doctors who can certify. But if AI can narrow the funnel of cases the doctor needs to look at, it's a huge improvement. And it really can be applied across all kinds of cancers.
Yeah, Caroline, I see you nodding your head to all of this. You know, weigh in and talk about that end-to-end piece of it, because even with Diana's story, she was diagnosed and yet the treatment was so far removed, even you know, through having to go to a different country. So talk to me about maybe the requirements, but also what opportunities might be there.
Yes, completely. I think for me, what is very important, and then it's very music to my ear to have references to several components that are very anchored on the way Roche is working. In having both the diagnostics and the therapeutics under the same roof, as we are developing our programs and our access programs and our partnership, we're making sure that we have that integrated approach. And then that's really what John and Tisha has mentioned. The opportunity here is, as was mentioned, is really to be more efficient, to really help the healthcare system to catch the diseases early on, really having that full integration of screening, early diagnosis, and early treatment. And this to really increase the chances of patients to have better health outcome, but also to have lower costs for the patients and for the healthcare system. So this is really a critical approach that we would like to be embraced more globally and hopefully being reflected in these upcoming renewed commitments on NCDs.
Ambassador, you can call me Tara. Tara. Thank you, Tara. I think everyone's touched on, and everyone in this room certainly knows, but we heard John mention you can have fantastic plans, and the private sector can be doing what it believes is best policy, but it doesn't matter unless there's a governmental policy to support that. What needs to be done in that area? What would you like to see happen at these meetings that can help marry that?
So I think John mentioned partnerships, and that feels really key to this. So I don't think any entity in isolation is able to see through the innovation that we need to see in this space. So I think it has to be a sort of across-the-piece effort. And I think particularly given the demographic changes we're seeing now, and what's happening in the technology space, Tishi gave some great examples of the benefits and the advantages. So we definitely want to harness this. And I think from a UK perspective, we're certainly looking at the safe, ethical, effective application of these technologies and innovations. And we're looking at how do we utilize them to support the sort of three main shifts that we want to take place in the UK's health space, and that's around moving away from hospitals towards communities, moving from analog to digital, moving from treatment to prevention, and I think technology can help across the piece. But ultimately, as you mentioned, Maggie, there's a sort of broader kind of regulatory environment, there's the enabling environment that I think governments have a big role to play. And I think that's actually why this high-level meeting is coming at a really good time, because I think it facilitates that conversation that involves a wide set of players and actors, both those member states at the UN, but also the wider actors involved in this space. And I think that conversation, that dialogue, that will hopefully get us to a point of sort of consensus and a document that we can all agree on will provide a bit of a set of parameters and guidelines to help us all utilize these technologies to tackle NCDs and mental health more effectively.
Tish, I saw you nodding vigorously when she said from hospitals to community. Why is that so important?
I mean, a health system is a full ecosystem, right? And even if you look at like the pandemic and we think, okay, it's one particular disease and we resolve it with a vaccine eventually, right? But there's a whole complicated health system behind that, right? And so the topic of health system strengthening and looking across is, yes, it's laboratory equipment, it's different types of radiology or treatment equipment, but it's also very much built on people and the whole thing working together. So the funding piece comes in there, whether it's partial government funding, partial private funding, but also, I think Diane said it very well, patient navigation is a huge topic. And this is one thing that's a little bit different with non-communicable diseases, right? This is not your communicable disease screen and treat. I don't want to oversimplify, but we do have a tendency around the world. We look at what's happened in HIV, we look at what's happened in other diseases, and that's a single disease approach, which has been tremendously effective, taking nothing away from that. But non-communicable diseases really require a full ecosystem, right? It's a health system. Each screening might be similar, but each patient pathway is different, depending on the different things that happen to them. So this is where I think it really requires building a system, and those partnerships are necessary, but really understanding a full pathway. And there's no one entity, be it a government, be it a private sector, be it a non-governmental organization, that really can cover the whole pathway alone. So really building this in this ecosystem is super important.
Well, I think you just laid out why perhaps implementation has been so hard, in addition to the funding, which we will get to and we know, but there are so many, each journey is unique. There are so many parts of this that have to work together. John and Caroline, I'd like to hear from both of you. John, what do you think is the biggest barrier? I mean, when you have to fix a lot of things and it needs to seamlessly work together, sometimes it can paralyze, or you can't focus on what to start with.
Yeah, I think you mentioned almost the patient journey, and I think we get that gets overcomplicated, and we don't learn from some of the great work. Many of you have been involved in the amazing work that's been done with HIV, and I think we can go back and use some of that to also look at how do we manage NCDs in remote areas and use the learnings from that. It's really, really important. We have to work closely with agencies around regulatory process as well. One of the biggest barriers of innovation and speed of access, particularly for medicines, is regulatory process. It's very, very complex. I have 40 products that we have from an impact brand from Sanofi. It's taken me 3 years to get some of these registered in countries in Africa. And it's only because they want to start from the very beginning. It's the same product with a different box coming from the same production line. But we have to help people to understand how to overcome these areas. The other piece, and I want to go back to the digital AI piece, we've got to find a way of collecting patient data and collecting that patient data along the continuum. And how do we use smartphones? How do we use AI technology to not repeat tests and not repeat information gathering for patients? We should be able to capture that at remote areas now, and as developed partners, we should be doing that to help them understand that a patient needs to be managed and that their data is really, really important from day one. And we don't have to repeat tests, and we can use AI to follow that.
Yeah, that's going to be really important. And you just mentioned that, Caroline. I think when people from the outside, and this may be policymakers in some, we talk about innovation in the medical field. We're used to thinking about breakthroughs in treating diseases and some of the lab research, but innovations and harnessing tech can be in many different areas when it comes to access. That maybe needs to be part of the holistic conversation.
Completely, and really innovation goes beyond, bringing breakthrough or life-changing medicines, devices, and therapeutics. It's also the way we can reimagine the healthcare system with governments and stakeholders, so the healthcare system is more adapted, and then we move away from having healthcare systems that are reactive to healthcare systems that are more proactive. So I think this is really a mindset that needs to happen, and all stakeholders need to actually sit together to actually have that reflection. And you were mentioning earlier this impression sometimes of being paralyzed. There's so much to do, and then it can be perceived as a daunting task. Addressing the NCDs is huge, and then it can be perceived as unachievable. But actually, there are significant examples that have already been developed on the ground that the industry and many stakeholders have contributed to. And I think maybe it's about time to also learn from those examples. There's no need to restart everything from scratch, but maybe to think about how those existing examples, mechanisms, partnerships, ways of delivering the care where patients are, really getting closer to the patients through remote systems, through new formulations when it comes, for example, to pharmaceutical industry, developing new formulations, or monitoring devices, or self-tests, all those systems that can alleviate the healthcare system, that can bring the care closer to their home, if it is where it is more convenient to them, that's going to really release a bit of the pressure of the healthcare system. So all these mechanisms exist. I think at this point of time, it's really how we can scale up what has proven to work. And it's really about to have that conversation on how can we leverage those best practices to make sure that we're not restarting from scratch. There are certainly some new ideas that can come and then that will continue to improve what we're all trying to achieve. But there are already a wealth of excellent examples that have been impactful, and then we can capitalize on those ones.
Yeah. Tara, would you like to pick up on that? I mean, we keep hearing over and over again, we know this is impossible without partnership, and yet...
Yeah, I mean, I was going to actually pick up on a few of your points, Caroline, because I think the fact that we need to move away from a reactive approach is absolutely right, and I think for NCDs it is so relevant because there is so much that you can do in a sort of preventative way related to lifestyle and health choices, and I think that is very much from a UK perspective. Given funding for the NHS is something that we talk a lot about domestically being a problem. How do you address that? It's by reducing the amount of in-hospital care that patients need to receive and preventing people from getting to that point. So really that is a lot around lifestyle sort of choices, and that is where wearable technologies are really important and where I think we use continuous glucose monitors as well to help build that data picture, John, that you were talking about, but help people manage their own experience and their own treatment. But I guess on the point about partnerships, Maggie, from a UK perspective, we're investing a lot in research, and some of that is done with private sector partners as well. And I think we recently announced a sort of 82 million package worth of research, which includes support from the private sector. And really what comes out of this research that's looking at, how do you do more early diagnosis of cancer? How do you do more on early diagnosing various different aspects also related to NCDs? And that research is not just something that will benefit the UK, but should be widely applicable, globally beneficial, and I think that's the benefit where where countries like the UK are investing heavily in tackling NCDs. All of these approaches should be relevant across the piece.
And that sharing information we know is possible based on what we went through with COVID. I mean, that showed that things can be done differently. And so trying to pull that into an area like NCDs, the expectation is that that's what should happen, but we need to get there. I'd love to hear from Tish and John examples of partnerships that you think are working, that you have found successful, that might be an example for others to base their work on.
Sure. I mean, I'd love to give some credit to the Egyptian government who created the space for some very effective partnership work around breast cancer. So about a year and a half ago or so, Egypt declared that Egyptian health is women's health, basically saying that if we don't address women's health, and they've started a comprehensive breast cancer screening program across the country for the 30 million women in Egypt, 30 million plus who previously didn't have access. And they created the conditions by which, they did things like saying, well, okay, here's the data on where we have equipment and where we don't. Here's the data on where we have, we're sharing the information about where we have trained staff. Different industry players have come in to support that. I do believe Roche is involved. From a Siemens perspective, we're providing some mammography units, but what's really important about the Egyptian case is you have also academia, in our case it's Cairo University who we're working with, to train clinicians across the country. And what we do is we go and we train in these training camps a week long, staff in their own environment, rather than pulling them into Cairo and training them in an environment, in a space that's not where they normally work at. We train them in their own hospital in a camp rotating across the country. It's enabled about 300 more clinicians to be ready to read mammography and support women through that pathway per year, and that will keep going for the next couple of years. There's many players, but the government really set the framework that allows us all to work in that space, also bringing in academia, and I think it's a great commitment and a great example.
So I really go back to, I mentioned Tanzania a few minutes ago, but the ambassador's comment at the beginning as well was a really interesting one, because we sat down as 5 pharma companies with the Ministry of Health for a full day in Tanzania and looked at their strategic healthcare plan, which was very sophisticated and very detailed up to 2030, with targets. What was most interesting was they had a funding amount that they were called investing rather than spending on healthcare. And I think this mind shift of investing in healthcare rather than spending on it is the big turning point, because once you've got that commitment, it makes a difference. Then the best bit around that has been also that we've had great NGOs on the ground who are able to work directly and really well and with very skilled and efficiently in the remote areas. And again, the data collection using AI, using smartphones, using technology to actually screen, and I think many of us have mentioned screening, because screening and prevention at the beginning is just as important, and that can save a lot of resources. But the government had a plan and a target of number of community healthcare workers they wanted to get to. And it was pretty ambitious, from a number around 5,000 or 6,000 up to over 40,000 in the 2 or 3 year period. And they knew they couldn't do it on their own. So it almost forced the partnership, and it forced the piece that we had to all work together. And the interesting discussion was, how are you going to sustain this afterwards once all the training's been done? And how are you going to pay people who perhaps weren't even paid in the past to deliver healthcare? And this again was a really almost a business plan and a proper structured plan around health that makes you realize that when you do something, it's going to make a difference and it's going to be a continuum. And this is where we're able to have a broad reach across many NCDs. It's interesting sitting on this table, you have different companies with different skill sets and different NCDs that we all focus on. And this again was bringing a group to the table that was able to train a community healthcare worker across a broad spectrum in one go. And this is, I think, really, really valuable from a sustainability point of view. And that's, I think, a gold standard of something that will really work. But it starts from that commitment really at the country level to invest in a sustainable model.
Go ahead, Tisha, before I get to
Yeah, I want to double underline that, right? This topic of investing in health and the fundamental of a community, to have a thriving community, to have continuous job creation, to have continuous economic growth, is a healthy community, right? If people cannot work, people cannot go to school and learn if they are not having some fundamental levels of health. And no matter how you do the business case, it always works out. But it takes a big momentum to start, right? This is not a small task to take forward. And I think this, it was said before, but healthcare as a human right. Healthcare is the foundation. Solid healthcare is the foundation of healthy communities. And remember what John just said about those community health workers. That's 40,000 jobs in that country, now paid jobs in Tanzania that didn't exist before. That creates additional economic growth. Of course, the patient piece of it is absolutely critical, but sometimes we also have to turn around and also look at the business side of it, and it makes good sense. for governments to invest, for entities to invest in their communities and healthcare.
And Caroline, to me, it sounds like you just mentioned before health systems need to be proactive, less reactive, more proactive. In a way, so does the planning around this. I mean, the example you're giving, John, sounds like something that enables governments and partners to scale. I mean, that must be the key. Do you see that happening in the work that you're doing? And can these blueprints be something that's scaled and be something that pulls into the high-level meetings?
So we do see this already happening, but unfortunately it's not at the scale we would like and at the pace we would like. So this is really where I would reiterate my earlier point. We could save so much time in actually learning on what we have observed and that has been proven to really work. And then we have just renewed last year a partnership that was rewarded in a sense that it was showing kind of best practice on how to engage, how to plan those partnerships in a sustainable manner. In Côte d'Ivoire, that is focusing on breast cancer. And this is an initiative that we launched back in 2014, and that is renewed towards 2029, if I'm not mistaken. But just to show that there are examples, and then that would be the example that I'm mentioning is only the one from Roche, but then there are certainly plenty of other examples from the pharmaceutical industry and also other stakeholders. So this is really where it's about time to really capitalize on that, gather all this experience, and also save some time. John was mentioning those conversations that he was having with Tanzanian government. This is the conversations we're also having with the governments we are working with on the ground in every country we're operating. And Roche is operating in 130 countries. So I'll let you imagine all the conversations that is happening. We have a wealth of learning that we can share. So as we are sitting for entering in new conversations with another country, we can capitalize on what we learned from somewhere else. So I think this is really, for me, the strongest message is rather than describing an initiative that happened here and there is what we learned from there. What did work, what didn't. And then as we are embarking into another journey in another country, probably with the same type of issues, perhaps not necessarily the same magnitude, but can we actually use what we learned already?
Absolutely. So let's end with you, Tara, and what's your call to action as we approach this meeting in September? Of course, there's a hearing tomorrow, but in September, what needs to happen to help not only move policy forward, but that really important implementation part?
Yeah, I mean, we're facing a difficult backdrop to the meeting, the NCD and mental health high-level meeting, but a whole variety of other high-level meetings that will take place during the General Assembly week. And so I think, building on the ambassador's points earlier, there's a point around just global partnerships, that is member states working together to recognize common challenges that they are facing and understanding the need to share lessons, recognizing the role that wider actors have to play in this environment, that governments can't do it on their own. We're in an environment where there is much less development assistance in this space, and that requires a real partnership approach. And I think, Caroline, it's, I liked your point about, sharing what works, but it's also really what doesn't work, because often you find countries making similar mistakes, and we have to try and learn from that and avoid that. But, I think this is an opportunity. Last time round we had this conversation, I think it was in 2018. A lot has changed since then. So I think we really have to take advantage of this moment and this, where we are in this time period and try and build the global sort of consensus around these issues and how to tackle them.
Especially at a time when we have technology as a tailwind to help to achieve some of what you all talked about.
Absolutely, and to scale, I think, to help scale some of the solutions and help make them affordable and accessible, right? Because the initial upfront costs might be higher for some countries that are investing in this, but as you replicate that elsewhere, the costs should come down, and that's where I think the investment that we put into this really pays off.
Fantastic. Fantastic conversation. Thank you all so much for sharing all these wonderful examples. Thank you.
Thank you.
And follow me out this way.